Geoffrey Sher, let's get some expertise with regard to this. Can he really do it? And if he does, how will it happen?
Well, first of all, to me it comes across as a bit of a party trick, to be very honest with you. We're nowhere near the time where we can contemplate true cloning in humans. It's going to take years.
Well, he says 1.5 to 2 years.
Well, that's why I called it a party trick. It's not feasible. I know people that have been involved in animal cloning for, as I say, for decades. They will tell you that to contemplate doing that kind of thing in humans is both irresponsible and dangerous, and I would oppose it strongly.
But let's look at...
Do you have any problem with the septuplets, 7 children being raised simultaneously?
Well, like anybody else, we're sitting with bated breath hoping that everything turns out well. Unfortunately, the fact that the babies might leave hospital healthy by no means assures anyone that they're going to not have any problems in later life. In fact, 1 out of every 2 pregnancies associated with a triplet or greater pregnancy is going to result in 1 or more of those babies having a problem either in mental or physical development in about 50% of the cases. To those people that say that medicine shouldn't be in the realm of business, wake up. Look at managed care. Look at HMOs. What we're saying is that in this one area of medicine, where the endpoint is so clearly defined, you can use it as a yardstick of your success.
Dr. Geoffrey Sher's Pacific Fertility Medical Center is among the first to offer package deals. In the latest version, the upfront cost is slightly higher than usual, but includes what amounts to a money-back guarantee.
What we're doing is saying to them, not only do we know that we have a good chance of getting you where you need to go, but we're prepared to put our money where our mouth is. The bottom line is, when it comes to cost, this plan virtually completely removes the concerns that affects most infertile couples. Namely, how can I avoid spending all of my savings and get nothing to show for it at the end? Roughly 50% of women who have a disease called endometriosis or have scarring in their pelvis due to infection will have these antibodies, which hang around, and when the embryo finds its way to the uterus, a good percentage of these women will find that their embryos are being destroyed very early on. And what you have to do is you have to keep the antibody away from the embryo by using this treatment of heparin and aspirin.
She doesn't mind the aspirin treatment, do you, Amy? No. Now, it's the other treatment. Tell us about the other treatment, doctor.
Well, we found that there are a percentage of women who don't respond to the heparin aspirin alone.
Heparin is a shot, right?
Yeah, it's a small shot, like an insulin shot for a diabetic. It
thins the blood, though.
Not at the dosage you give.
All right.
And it doesn't cross to the baby, so there's no risk of going across and causing harm to the baby.
And you don't do that throughout the pregnancy, you just...
In some cases you do, but you probably don't need it as long as that. We're learning that as we go along.
And the second treatment?
The second treatment is where you find certain types, and there are nearly 20 types of antibodies we look for. If certain antibodies are present, they won't respond. Then you have to give a blood product, which is known as immunoglobulin, or intravenous gamma globulin, which contains antibodies that kind of mop up these unfriendly products or antibodies that would attack the embryo, and you have to give these infusions monthly. Not necessarily, and we're back to the issue of checks and balances, and I'm very much for regulation of this technology. For all one might have to say about what's going on in England with regard to eggs from aborted fetuses, at least in England there is a system with checks and balances that makes sure that things are done uniformly. That does not exist in the United States. There are guidelines and regulations, but no ability to enforce any of these, all the way down to enforcing verifiable reporting of statistics and outcomes in the field that we're in. So I think anything unharnessed and without checks and balances certainly is open to abuse.
Doctor, you wanted to say they'll cover penile implants.
No, I just said that...
They won't cover this.
It's crazy. I mean, you see the joy here, and yet insurance companies will cover things like penile implants, and they won't cover infertility. And you wonder whether these companies are not being run by men that view impotence as life-endangering and having a baby as a vanity.
Domenico is 10 months old. His sister Marisa is 3 months old. And by all biological standards, they're twins.
I am not aware of any other situation that's ever occurred yet to date where twins have been born 7 months apart. this has got to be a first.
How can that happen?
Well, about 1 in 50,000 pregnancies, the embryo, the baby, will attach to the wall of the abdominal cavity or the bladder or the surrounding area and grow there. But I don't know of any other case besides this particular case where the baby survived. So you're very, very fortunate.
You are a lucky guy.
This is so devastating. I mean, people don't realize the impact that infertility has on the lives of human beings. This lady, in my opinion, at 41, should really be proactive. And I'd like to invite you to maybe call the show up afterwards and find out my telephone number and call me at Pacific Fertility Center in San Francisco, and I'll spend some time with you on the telephone to discuss your situation. It seems the time has come to be proactive, and I'm sure that we can help you and offer you some good advice.
The vast majority of women that we see here in the Bay Area are in their late 30s, with an average age of about 38 and a half. And so we call women under 35, from a fertility point of view, teeny boppers.
Is the medical community that irresponsible, or is there, I probably should say, so few regulations that this is a possibility?
Well, first of all, let me say that some of the comments you've made, I think, are correct in principle, but the statistics aren't correct. First of all, there's about a 50% chance with ovum donation in our program, for example, when you do a single case that a woman will have a baby as a result. And with in vitro fertilization, for women under 40, a 37% chance of having a baby. That's higher, or as high as one can have in nature. And yes, you're right. We need to get checks and balances in place. I don't know whether this will turn out to be actual and authentic, that your embryos have been misappropriated, but if they have, it's reprehensible. And we need biting regulation, and we certainly do need a governing body that will govern rather than be advisory, and have recourse if we don't follow the guidelines. Society sets those guidelines, and we mustn't, to use a pun, throw the baby away with the bathwater
Well,
here.
this may be a precedent-setting case along with others. I want to say that Dr. Sher has a book out called In Vitro Fertilization, The Art of Making Babies. It's on bookshelves just now. Very timely, and in it, this is a big reality check of the state of the art of this business.
The ideal candidate is a woman that has a healthy uterus, is healthy enough to carry a child, and that's about it, and wants to have a baby, because the male infertility part is irrelevant now with new technology that allows us to inject a single sperm into the egg. Whether the man's got a few thousand sperm or 100 million doesn't make any difference in terms of outcome. So certainly the male partner plays a role, but there's hardly a problem with in vitro fertilization with male infertility. And the age of the woman, and it doesn't apply to Stephanie, obviously, but if she's near the menopause, doesn't matter either, because we get 50% birth rates per attempt when we use donor eggs, from donated eggs from young women under the age of 35. And so that it's 50% per attempt. Right. So really there's great hope across the board for infertile couples today.